Unfortunately, what we know is that families are experiencing a higher than normal level of stress, of household stress, relationship stress, parenting stress, and families have financial, obviously, too. And families have fewer resources to turn to. Child care centers are closed, churches are closed, schools are closed. Grandparents are in isolation. So families are really struggling. And we know when that isolation and that household stress increases, so does the risk of child abuse and neglect. Unfortunately, we're not seeing that currently in our numbers, because when kids aren't in school or aren't out in the community doesn't have eyes on them, and they're not making those referrals to our Department of Human Services. So it's something that makes us quite nervous, because we know what the reality is and we're not seeing it. If we see that for this year, our child abuse and neglect incidence rate has dropped even more, we know that that's not going to be an accurate reflection of what's actually happening here. We're really looking forward to the day when we can see our families face to face, when they're in school and we're more accessible to them. Rural communities often are in food deserts, so access to food is limited even in normal times. So when grocery stores started having shortages, we really struggled. Whether a family had the financial hardship or not to pay for food, it was really difficult to access food anyway. A lot of our jobs in Teller County are service jobs. So when casinos close and restaurants close and bars close, and we have a huge number of overnight camps in our community too that we're not able to operate. It really hurt Teller County as far as economics and job security and financial security. And then when the public assistance benefits kicked in, we were initially addressing that food need, and then we were addressing connecting people to the benefits that they qualify for. A lot of people have never applied for unemployment in their entire lives. They have no idea how to go about doing that. They aren't comfortable with the concept. So it was a lot of helping people feel comfortable and then accessing and following through and getting signed up for what they need. And then we felt a little bit of relief from that direct need that people had from our center. But now it's more addressing kind of the isolation of families. Families are getting over one hurdle at a time, but really the cumulative effect is that isolation and lack of support. So right behind me is the COVID testing that we're doing in our community 5 days a week. We're really fortunate to be co-located with our public health department right next door here. And we serve on our Teller County Combined Agency team, which is managing the community's emergency response to COVID. So working together to make sure families are able to access the emergency support that they need on top of the normal services that we need. We've had a lot of agencies that weren't able to stay open in our community, so the burden has really fallen on this team, this combined agency team, which includes law enforcement, fire, EMT, our county leadership, our public health department, our Department of Human Services, and several nonprofits that have stepped up to support getting services to families. Community Partnership is incredibly grateful for the extra support that we've received during COVID. We've been able to keep every single staff member employed throughout this emergency at their full capacity. We've had the flexibility, thanks to this funding, to adapt our programs to come up on the fly with virtual formats of things for families. If they are in a place where they want to engage in a program, it's there and it's available to them. Our staff is available to families virtually, but at the same time, we recognize that this might not be a good time or an ideal time to ask families to engage in formal programming. So our emergency funding has given us the flexibility to just reach out, to just make that connection with families, to answer their questions, to give them reassurance, and to connect them to resources that they need. So one of the services that we did not provide prior to COVID was having a food pantry. We have a number of food pantries in Teller County, and we've always kind of felt that that need was met. It wasn't a gap that we needed to fill. It was Friday, March 13th, when we had one day. Schools had one day to close down, pack up the kids, get the buildings shut down, and one of the big surprises for them was, what do we do with all this food that we have in our kitchens and for our backpack program? How are we going to get this out to the community at a time where they need it most if we're not here? And so we just started receiving calls from the schools. Can we bring you our produce? Can we bring you our canned goods? Can we? And we initially thought, of course, bring it. We'll make sure it gets to other agencies who do this type of work. Well, it turned out that some of the other agencies were churches and food pantries that are staffed with senior volunteers, so they had to close their doors. And so that, combined with the increased need, we just ended up continuing to take in food from, like I said, overnight camps that were having to close, churches that were having to close. And it's been sort of a revolving door of food here, because we have access to the families and we have access to the partners with the resources to get food to the families. And we've been serving as that connector by having a new food pantry. One of the silver linings of COVID for us, for our agency, in addition to the stress and uncertainty that it's brought, has been sort of a different platform for engaging with not just the families that we serve, but with our partner agencies, with our funders. This has required us to be in almost daily contact with some of our partners. It's really strengthened those partnerships. It's really helped us address gaps that we didn't foresee before, but also gaps that existed before that we're better able to address now.